Welcome to the Pharmaphorum podcast. This is web editor Nicole Raleigh, and today I have with me Brian Coane, health partner at creative agency Leith. Welcome, Brian.
Hi, Nicole.
So today, Brian and I will be discussing the importance of humour to break down barriers and do away with stigma when it comes to pharma and health advertising. But before we sink our teeth into today's humorous topic, if you will, Brian, perhaps you could share with listeners a little about yourself and the journey that led you to doing what you do today at Leith.
Yeah, sure. I guess I thought there was really two things that are worth sharing around how I got to where I am today, and also around the topic that we're talking about. So in terms of the topic, I think it's health and it's humour. I think humour and advertising is something which, for me, when I look back, is maybe clearer, as often it is with journeys. When you look back, you look at the journey you've taken and think, actually, I can see where things came together. And actually going right back to when I was young, and my dad had a bar and restaurant, and one of the things that I was very conscious of was around different brands, and particularly drinks brands and brands that were really prominent at that time tended to use humour a lot in their advertising. And when I look back now, I think one of the things that made me want to get into advertising in the first place was the fact that it was a bit of entertainment. And I think the advertising that you engaged with most was advertising that had some form of entertainment and a little bit of reward for the viewer or the listener or the reader. And so now getting the chance to think about humour and think about it within the context of health is really quite rewarding. But the health side of the work that I do really comes from having been at Leith now for a number of years, and we've worked a lot in the public health area and on campaigns with the government in the UK and and more widely, and particularly focused around different topics like early detection of cancer, around vaccination campaigns, around and mental health. And so it was always an area that I really enjoyed as part of my role at Leith and part of my role in developing advertising, and particularly thinking about how you can be working to make a difference to people's health. And so now I manage the team at Leith who look after the work we do in health across campaigns for the government, so disease awareness or public health campaigns. But we also work with pharmaceutical companies and their campaigns directly on reputational campaigns with organisations like FPA who represent the industry in Europe, and then more widely around kind of wellness and health more broadly with companies like Love Honey. So a real stretch from reputation and corporate communications through public health and disease awareness to sexual health and wellness more generally. So a real broad range of topics within health. And as I say, the opportunity to think about humour within those is enjoyable, but equally it makes you think about how you can engage across a lot of different areas and different topics and different clients.
Absolutely. As you say, a very broad remit there at Leith. Humour, though, it's an essentially human quality, isn't it? So this is no doubt why research has revealed that audiences are twice as likely to notice ads using humour, 3 times as likely to remember them, and 4 times more likely to take action as a result of seeing those ads. But when we think of humour and advertising as entertainment, we don't necessarily think that those go hand in hand with, say, pharmaceutical or health advertising specifically. So perhaps we should begin our core conversation with a little more clarity on this. There are different forms of humour. So which are we talking about, Brian, and how can they be used sensitively and yet with maximum impact?
I think when you think about different forms of humour, and if you think about it on a personal level, I think we all understand different forms of humour. Some words are more likely to make us laugh. So taboo words, comedians always say, boobs, pubes, fart, always get a bit more of a chuckle from an audience than others. Harder consonants are funnier than softer ones. So, it's no coincidence. I don't think that 2 of our best swear words end with a kit. One, starts with a kiss sound and the other ends with a kiss sound. And some comedians just make your belly laugh, whereas maybe sometimes when you go to a comedy show, it makes you feel a little bit uncomfortable. And I suppose that's the same way as some jokes you're happy to laugh at sitting next to your mum. Some are better shared with friends. So I think we all can understand the right type of humour will have the right impact in the right moment. But for some reason, as communicators, we find it hard to apply that sort of everyday knowledge, if you like, to our professional lives. And I think many people fear using humour in communications. And so the sort of biggest perception, or the biggest reason I hear that's a perception that humour is not appropriate, and particularly not appropriate for health, is that you can't joke about illness. And kind of coming back specifically to your question about what kind of humour are we talking about? And I think some of the funniest ads that I've worked on in my role at least have been perhaps on the most serious health topic of all, on cancer. We've used humour around screening for breast cancer, for bowel cancer, for cervical cancer. And what I think that really shows is even when you have a serious topic, or if you feel you're a serious brand, you can still use humour in your communications. And really, because humour is very broad, it includes intelligent wit, it includes charm, it's about making people smile. You don't have to go for that belly laugh every time. And we think about in our own personal lives, there's some friends who make you chuckle and some friends who you'll have a really good laugh with. So it's simple to think about the right humour for the right moment. And one of the things we've been doing as part of the work around humour is to do an exercise with clients where we actually work with them to match their brand positioning to the humour style. And so if you actually kind of almost think about where your brand or company sits and what its tone of voice is, and then think about what the humour style should be that can match with that. So for example, if you're a caring, sensitive brand, then your humour style could be the innocent smile, for example. Or if you're very much more of a sort of focused, controlled brand, then you might use clever wit as part of your communication. So I think any brand can be funny. It's just choosing sort of appropriate humour style for that brand. And I guess for the moment of communication, we saw last year with Body Form, their brands are typically seen as very empathetic or caring and sensitive, and they've used an innocent smile to poke fun at the journey of menstrual health, really effectively last year. So I think there are lots of different types of humour that we can use, and that's one of the things that you try and do is think about what type of humour can you use and how can that come across in different communications, different campaigns, different moments, different activities. But it's not a case of it's you're right or wrong. It's more about what's the right type of humour to use for this brand or for this moment, if that makes sense.
It does. As you say, it takes a little bit more consideration and care over the TOV or tone of voice of each brand. But when we're thinking about, let's call it the necessity of still utilising humour in advertisements for serious indications, as you've been discussing, including cancer, why is the fear of getting humour wrong in ads not only leading to vital messages over those indications being missed, say for screening, but also creating a beige tax? I mean, in the US alone, I believe advertisers have to collectively spend an estimated $189 billion to have the same effect for dull ads to be equivalent to the effect as non-dull counterparts. So firstly, is that correct, Brian? And if it is, or if it is not, tell us more and what is correct.
No, that's right. So it was a study by WARC, the World Advertising Research Centre, who came up with that 189 billion for US advertisers. And I think they also found in the UK, a brand with what they would describe as a dull ad would need to increase their media spend by 7.3% to have the same impact as a funnier ad. And so the reason for that is that humour is one of the most effective drivers of successful comms. And some of the things we found, and we worked alongside the Advertising Association's research think tank, Credos, and looked at their research and looked at how humour drives effective advertising. And I think, as you mentioned earlier, they found like number one, that it's twice as likely to get noticed, 3 times as likely to be remembered, and 4 times as likely to trigger a response. But I think when it comes back to the beige tax, there's a couple of things that are really quite pertinent, that humour also connects at a second, deeper level. So it engages emotionally to build relationships with the brand, not just the advertising. So in a way that humorous ads don't. It creates a much more positive brand association. And a survey by Oracle found that 72% of consumers said they would select a humorous brand over the competition. And the third area is that humour has an impact in a way that is maybe unexpected, but it actually builds trust. And so Credos worked to identify exactly what drives an individual to trust or distrust advertising. And what they found was that enjoyment of ads is more important than any other factor in driving trust. And humour, of all the levers that we can pull, to trigger enjoyment is the most likely to make an ad enjoyable. So when you think about a brand or with a message or a product or whatever it might be, an organization, that also makes it more trusted. And that really is what makes the difference in terms of engagement and those figures that you mentioned in terms of thinking about and using humor as a way to strengthen your communication is actually going to make it more, a better return on investment, more valuable for the organization as well. So, whilst people do often think about humor as being a risk, I think there's a fear, they have a fear in terms of using humor. I think if you think about it the other way around, I think if we don't consider this as an option, and clearly we're not saying that you would always want to use it and you can never produce an ad that doesn't use humor, but it's certainly something that's underused at the moment. And there's an opportunity to then say, well, how can we, have more effective marketing spend as a result of using humor for sure.
Yes, as you say, this trust element is a critical ingredient in the process. I think also listeners, based on all this that we've been discussing, listeners would like to hear more information about Leith's A Healthy Dose of Humour campaign, which is looking to debate the science behind using humour in health ads by bringing together scientists, strategists, creatives, and top comedians. Can you share some more details?
Yeah, sure. So Healthy Dose of Humour is a podcast series which we launched last year. And it just explores the links between laughter, health, medical communications. The podcast is hosted by award-winning comedian Ria Lina, who's also appeared on Mock the Week and Have I Got News for You. So she's a great host and entertaining in her own right, as well as being entertaining on the podcast. It's an 8-part series, and what we try to do is to bring together a panel of really interesting different people with different perspectives to talk about the topic of humor. And so we've got neuroscientists, we've got patients, creatives from Leith, and healthcare professionals as well. And we cover a range of different topics, but starting with the basics really about why do we actually laugh and what makes us laugh, and how we help. How humor can help us live longer. And we do explore how marketers are missing a trick when it comes to using humor in healthcare and communications. And one of the things that was interesting in the podcast series, when we spoke to patients and when they talked about how they'd used humor to help them in their journey through an illness or through a condition, and that really humor forms part of that. And I think often we talk, particularly within healthcare comms, around being very patient-centric and involving the patient in developing the communications. And often when you speak to patients, you find that they're happy to use humor. In fact, one of the things that's interesting from our perspective is when we've spoken to patients around sensitive topics, quite often what you find is that the wider public, people who maybe haven't been affected by a topic like cancer or who aren't going through a cancer journey, feel it's inappropriate to use humor. But actually, when you speak to people who are in it or have been through it, they say, do you know what? If humor gets people to pay attention a little bit more, or if we can engage with people, or in fact, when I'm be talking to my doctor or talking to my consultant, then one of the ways that they use is, a joke goes a long way to lighten the mood and get across, an important piece of information. The industry keep on trialing new and innovative ways of communicating, improving people's health. And as we, understand, it's not right for every ad or for every comms plan, but it really is one of these areas that's undeveloped and underutilized in the sector. So hopefully it can inspire people to try out, being a little bit more humorous in their comms. And
It's a coping mechanism, is a tried and tested, age-old
yeah.
Method for patients, isn't it? So from trust builder to communication tool, let's move to my final question, our conversation today. What dose on humour would you really like listeners to take away with them today?
I think the thing that I've taken away from this project and from working on it is that when we're developing communications, I think one of the questions that we don't ask ourselves often enough is how enjoyable are these communications going to be for the target audience? And I think we're all a little bit guilty of broadcasting information, and particularly in a digital media age where there's so many different ways to reach people, so many different points of contact, and so hard. It's a real battle for attention to grab people's attention. And I think we don't think often enough about, is this actually enjoyable? And then go right back to we started on thinking about one of the reasons I wanted to get into advertising in the first place was that I realised, looking back on it now, that the ads, the brands and the organisations that had a bit of entertainment, a bit of humour as part of their communications were the ones that I was most likely to remember and most likely to engage with. So I think it's thinking about that and thinking about how can we make the communications we produce as an industry, as a sector, how can we make them more enjoyable for people? Because the facts and the figures that we've gone through around building trust, building engagement, gaining attention show that humour is a powerful tool to use to be able to do that. And so if we think to ourselves, it's less about should I be frightened or apprehensive about using humour, and more thinking about what can I do to make my communications more enjoyable for the people who are going to be viewing them or listening to them or reading them. And that will end up in a stronger result for both sides.
Thank you, Brian, for this balanced discussion on humour. I apologise to listeners if you were expecting Brian and I to be humorous ourselves, but I think our balanced exploration of the topic should be inspirational. Thank you, Brian. It's been a pleasure.
And that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaphorum.com/podcasts. The pharmaphorum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for pharmaphorum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.